Hi folks, my name is Tim Black. This is a special edition of the Tim Black Show. In honor of Black History Month, this is number 4 in a series of interviews we've been conducting with outstanding, influential, and inspiring Black women. My guest today is family medicine expert physician and healthcare activist, Dr. Victoria Dooley. Dr. Dooley is joining us to discuss COVID-19, pandemic stresses, and of course, my favorite, Medicare for all. Hey, Dr. Dooley, how you doing?
Hey, Tim, I am doing good.
Well, like I said earlier, Dr. Dooley, thank you so much for taking time out. Finally, I got Dr. Dooley in the house tonight. This is great.
Woo-hoo.
That's what I'm saying. So just jump into it because I know you're a busy lady, Dr. Dooley. Coronavirus. Everyone, like I said earlier, guys, I was talking offline very briefly. Oh, before I even do that, folks, I want people to know who Dr. Dooley is. Dr. Dooley, I was on your timeline because Senator Nina Turner said,
Dr. Dooley, Lord have mercy, the one and only Dr. Dooley. I want to see Dr. Dooley be the Surgeon General, baby.
That's it.
You just don't get that. I mean, you follow her on Twitter. I mean, she tells it like it is, like it TIS is, baby. She don't take no prisoners.
And I said, okay, but now I seen your tweets, but there's one that I missed. So folks, get ready because here goes a little bit of Dr. Dooley.
We have talked a lot tonight about healthcare is a human right, what it means that so many of our people are uninsured or underinsured. Let me introduce Dr. Victoria Dooley, a strong advocate for Medicare for all single-payer system.
Dr. Martin Luther King said, of all forms of inequality, injustice in health is the most inhuman. Black people, African American people, have been fighting for the right to not die from illnesses that are too expensive for us to treat since we were freed slaves. They freed us, but they didn't give us hospitals. And then when we got hospitals, they were segregated and they were underfunded. So we didn't have the resources that we need to heal ourselves. So then what happened? When plagues came through our communities and our hospitals were segregated and they were underfunding, what happened? We died. And then they used that as an excuse and justification to say that we died because we were a weaker race. No, we died because they killed us. Fast forward to today. Fast forward to today. With every effort that we've made in this nation to insure more people, whether it be through Medicaid or Medicare or the Affordable Care Act, every single time there is still a disproportionate amount of poor people of all colors, Black and brown people who are left behind, who are left uninsured. After the Affordable Care Act, that Black people are still twice as likely to be uninsured compared to white people. And let's not talk about underinsurance. Do you have health insurance if you have a $5,000 deductible and you make $9 an hour? I think not. So every effort we made to insure more people, we are still left behind. Call me a conspiracy theorist, but I don't think that is a coincidence. So the only way that we can ensure that all people who look like me have health insurance is to ensure everyone. Because if everyone is included, nobody who looks like me can be excluded. And that's the way it should be. So Medicare for all is not just health insurance for all. It is healthcare justice for all. I worked in Flint. I completed my training in Flint. As a family medicine physician, I helped deliver some of those babies who are now subsequently poisoned by lead water. And then what do we give them? We give them Medicaid, which is better than nothing, but it tells everybody that they're poor. And it restricts which doctors and networks they can go to. Everybody doesn't accept Medicaid. That's not justice. Healthcare justice is the ability to go to any doctor, any hospital, any pharmacy, Healthcare justice gives you the choice to go where you want and get the care you need, and without anybody knowing that you are poor or low income because of the words on your insurance card. look at something in this nation like the horrible Black maternal infant mortality rate, how Black women are 3+ more likely to die during childbirth, what are some of the reasons that contribute to that? It is because we are under and uninsured. And so what are some politicians' answers for this? Where they say, well, hey, let's give people Medicaid for an extra year. That's insufficient. We need health insurance our whole lives, not just when we're pregnant and the year that we're after we're pregnant. So here comes Senator Bernie Sanders. And he says that Black lives matter so much to him that he is the only candidate who believes that we all deserve health insurance our whole damn lives. I know there's a couple people here, but I have some questions for the audience. They're rhetorical. If Black lives matter, doesn't our student debt matter? If Black lives matter, doesn't our health care matter? If Black lives matter, doesn't our ability to afford college matter? You see, Senator Sanders is not here to pander. He's here to provide answers to the problems that we are suffering in this community. He's here to cancel student debt. He's here to cancel medical debt. He is here to make public colleges, universities, and HBCUs free. They are public. You don't pay to walk down the public sidewalk. You don't pay to go to the public library. You shouldn't have to pay to go to the public college. Thank you.
All right, whoa, that was some smoke coming up there. Dr. Dooley, when you made those statements, what was going through your mind? Was it, what prompted you to come so real with it?
Well, I'm just that type of person. I keep it real. I went into healthcare because, we want to help people, right? And then as I started going through the training process and learning more of the business aspect, because I knew I needed to open my own practice for numerous reasons, but I knew I needed to open my own practice. And I realized how horrible of a system that we have. Our system is neither healthy nor caring. And then I'm very passionate about ending health disparity. So seeing how, just like with everything in life, in this horrible system that negatively affects us all, how Black and brown people still even get the short end of the stick. And then training in Detroit and in Flint, and just seeing the disparities. I just have to keep it real because we deserve better and we need better. My goal is that we see better in my lifetime.
Wow. Training in Detroit and Flint. Mm-hmm. Wow, that must have been a crash course in, because, economically distressed areas, poor areas, keeping it 100. They always get the worst. And I love how she put it, guys. She said, the short end of the stick, we get the shorter end of the short end of the stick. So with all things, that's how it ends up. So you started your own practice. When you hang out your own shingle, so to speak?
It will be my 10-year anniversary this summer. And let me tell you, there was a lot of reasons why I wanted to open my own practice, right? One reason was because I was a divorced single mom. I wanted to have freedom and flexibility to do what I needed to do. If my babies got sick, they came to the office with me. I had a couch, TV, video game in my office. So they were one of my biggest motivators. And also because of the way Black women, Black men, Black people get treated in our medical training, there were a lot of things that happened in my medical training that basically all boil down to racism. There's a lot of racism in medicine, just like any other aspect of life. And if some of those things happened to me as a practicing physician, I knew I wouldn't be able to keep my cool, because when you are residency, like, you spend hundreds of thousands of dollars. I'm hundreds of thousands of dollars in debt, right, to achieve my dream of being a doctor. And if you are vocal, you speak up, like there's multiple people on social media who are people of color who spoke out about racism and lost their jobs. If you speak up as a resident in your training, you fear losing your residency status. So if one program kicks you out, no other program might accept you. So then you wasted all these years and all these hundreds of thousands of dollars to get to a place that you're never going to be able to get. So it was just so frustrating, the obstacles that I had being a Black woman in medicine, the things that I had to deal with, that I said, you know what, I can't deal with it. I'm going to go off. I'm going to get fired. I have to have my own place where I am queen of my castle and where I don't have to deal with some of these obstacles that happen just like in corporate America, that happen in corporate medicine.
Wow, we hear a lot about the discrimination that patients face, but seldom do we hear conversation about what doctors face.
Absolutely. Black women are paid less than white women in medicine, Black men. So, I mean, the same the disparities that you see in other aspects of life, they carry on into medicine.
Well, wow. I just recently had Sean Rochester on, who's the author of a book called The Black Tax. And he went through and he looked at all these instances, and he talked about lawyers and some other professions where being Black is a tax. Whether you make less money, or whether you get more penalties, or you get scrutinized more closely, you get overlooked for promotions. You know the whole spiel.
Yeah,
so that's what you're speaking to, and there was some specific things that happened to you in your life that gave you pause and say, "Oh, in order for me, because I know how I am, I ain't gonna be able to just be quiet and take it."
Take it any longer. I couldn't take it any longer. So I said, you know what? I'm gonna be a stay-at-home daughter. Fortunately, I was blessed that I had parents who supported me. And I said, I'm gonna be a stay-at-home daughter. I'm gonna make $0 in the beginning. I'm gonna delay gratification so I can ultimately do what I need to do to help people and to maintain my own sanity.
That's amazing. I wish I could have talked my son into it. He wanted to get out there, man. He fell in love. That happens to us all. Happens to me and Mrs. Black as well.
Yeah.
So to jump into coronavirus, like we said earlier, I'm so glad you're here, Dr. Dooley, because people are so skeptical. They're hesitant about the vaccines. I was looking at the latest Johns Hopkins numbers, 106 million cases around the world, 27 of those in the U.S., and we're, 463,000 deaths in America. It doesn't even sound real, Dr. Dooley. What's your prognosis of where we are now with this coronavirus?
Well, I'm fully vaccinated. Being a healthcare provider, I was kind of at the front of the line. I am optimistic about the vaccines. I wish they were going faster. I will say that I believe they're gonna go faster with this administration than the last. I still have a lot of frustrations. It was a couple of weeks ago where I read African Americans have only received 5% of the vaccination recipients. And we're much more higher percent of the population than 5%. So why have only 5% of us received the vaccine? And I know some people of color don't trust the vaccine, but there's some white people of all colors who don't trust the vaccine. So I'm very concerned that health departments and health systems aren't doing enough to make sure that everybody of color who wants to get vaccinated gets vaccinated, because since we are more likely to die when we get coronavirus, I believe that we have to be passionate and advocate for our patients of color to get the vaccine. And so that's what I've been doing, making sure that I'm an advocate for all my patients, but I'm going to be an extra advocate for my patients who look like me and who I know are more likely to die and suffer some of the negative consequences of this. So we're certainly not at the end, but I am starting to see a little bit of light at the end of the tunnel. Tim, when they started all this nonsense, well, not nonsense, but all this talk about how, healthcare providers, grocery store workers, they're essential workers, right? You drive down the street and at the hospital, at the grocery store, you see heroes work here, but then at the same time, they're not giving us enough personal protective equipment, PPE. You had nurses wearing garbage bags. We're reusing masks for days that were supposed to be used one time, reusing masks for days. So even though there was all this hype about, we appreciate essential workers, I really didn't feel appreciated in the beginning. I was struggling to find the equipment that I needed for my office. And I felt like health systems, at the end of the day, they didn't care, because ultimately in this for-profit healthcare system is about their bottom line and their profit. I did not feel appreciated until I got my vaccine. And I felt relieved. I really appreciated the fact that they worked hard to make sure that healthcare providers got their vaccines in a timely manner. So that made me feel more appreciated than anybody's free coffee or talk about a sign about how I'm a hero. Because at the end of the day, we were burnt out, we were stressed, we didn't have the supplies that we need, and we weren't being treated like heroes.
So much out of that comment that I want to talk about. Let me go with the essential workers first of all, because I made a video pitch about this recently. You know, my brother drives a Metro bus here in Washington, D.C., and I use him as an example because people say, well, he's an essential worker. He's driving buses. He's helping the public. People still have to go to work. And they started saying that these essential workers were heroes. Oh, they're so heroic. No, my brother works pretty much lives paycheck to paycheck. Right, that's what that is, right? So if he had a choice, he'd stay home. And I know he's not a hero because when we were kids, I got jumped by these kids up the block. He didn't jump in. So he's not so much a hero as he's a guy who has to pay a mortgage. And he has kids, he has a daughter to take care of, my niece. Yeah. So if he was a hero, plus if he was a hero, Dr. Dooley, they'd pay him more.
Exactly.
Heroes get paid. Heroes shouldn't have to pay for anything, actually. So I would say, if you want to treat the essential workers like heroes, fine. Cover their expenses.
Yes.
And I don't mean their travel to work. I mean their living expenses, their food, shelter, everything. Car note, health insurance, new pair of shoes, get their hair done if they need it, whatever they need. Because if that's what heroes, that's the way you should treat a hero. So that was my soapbox moment. Now, you talked about the virus rollout. There are 3 vaccines, Pfizer, Moderna. They're talking 94% effective of symptomatic disease only. And then Johnson & Johnson's 100% effective at preventing hospitals and deaths.
Yes.
Are those numbers true? Because that sounds great. And I'm hearing people say they're scared to take it, but with numbers like that, I mean, how could we not take it?
Those numbers are valid as far as the clinical trials. So in the real world, they might vary a little bit, but I'm still super optimistic. I believe, what country is it? Is it Israel, where they're doing a great job of vaccinating a high percentage of the population, that they're finding that it's like 93% effective, the Johnson & Johnson and Moderna vaccines. So I think it's highly likely that we are somewhere around that 95, somewhere around 92 to 95% effective, even with these different strains so far, based on the data that we have. We still have a lot of people to vaccinate. We still have these newer strains and variants to contend with. But I was super excited about that Johnson & Johnson data because the worrisome thing was it was only about 74% effective against preventing COVID. But then, like you said, it was 100% effective in preventing hospitalizations and death. And if you get COVID, right, your biggest fear is ended up hospitalized or dying from it. So even if you are maybe 20% more likely to get COVID with that Johnson & Johnson vaccine than you are with the Pfizer and the Moderna, you can still have some reassurance that you're not going to end up in the hospital or die. And that's important, right? Because we only have a finite amount of vaccine. So some people, and you're not going to be able to choose which vaccine you get because it's a limited supply. You're not going to be able to go up to the health department and say, you know what, I'll take that one. You don't have to get what you get. So there's this worry about, are people going to get the worst vaccine, right? So even though it's not as effective as preventing COVID, I am very excited, as should your viewers be, that the Johnson & Johnson vaccine that has not been approved yet has been 100% effective in preventing hospitalizations and deaths. Wow.
You know, I didn't know that yet. I haven't gotten to the vaccine myself yet, but I do intend to take it. Me and my wife and I are going to take the vaccines. We just need a little bit more information, to be honest with you. You know, living here in Maryland, you know, we're hoping that we can take it soon.
Yes. So the vaccine, there's a lot of myths and false information out there about the vaccine. I'm not gonna lie, I was a little bit nervous about getting the vaccine, but I wasn't nervous because I thought it had a microchip in it. I wasn't nervous because I thought I was gonna turn to a zombie. I wasn't nervous for any of those reasons. I was just a little bit nervous because it was a new vaccine. So of course I was a little bit nervous to get it. But I also, after I got it, I felt so relieved. And then the week after that second dose, I kind of had a little quiet celebration because that's when you're at that 95% effectiveness. And one of my frustrations with the media is some people, after they got their first dose, still got coronavirus. Well, you're not 95%. And again, 95% is not 100%, but you're not 95% likely to not get the symptomatic COVID until a week or two after that second shot. So of course, there's going to be a lot of people who get coronavirus after that first shot because we're vaccinating millions of people. And then the media wants to hype that up like the vaccine's not working. No, the vaccine's working exactly like it is. You have to get the second shot and wait a week or two until you're up to that 95% effectiveness. So I was super relieved after I got it. Like I said, I had a little party a week after that second dose for myself because I just felt it. Because we're living in fear. I'm seeing people every day coming into the office. I'm relatively youngish and healthy-ish. And so I hope that I wouldn't have severe COVID, but I have young, healthy people. I knew young, healthy people who had severe COVID. And even if they weren't hospitalized, they might have had shortness of breath, fatigue, brain fog for months and months and months after the diagnosis and just overall feeling miserable. And look, we don't live in a country that guarantees paid leave, right?
Right.
So you have people who are sick for weeks and weeks and weeks after their diagnosis. But because we don't live in a country that has universal paid leave or even universal health care, they were forced to go back to work when they're not ready. So this vaccine is not brand new technology. The technology has been around for a long, long time. Because the coronavirus was new, we had the technology to make the vaccines a little bit quicker than we typically make vaccines. But that doesn't mean that the technology itself is completely something brand new and untested. That's just not true.
Wow. That's something I haven't heard spoken about either. And I guess there's no clicks and views and calming people down. More so, there's more clicks and more revenue to be made or more,
right.
For viewership, for
sensationalizing and fear mongering.
Yeah.
Yeah.
That's playing on people's stress. I know we wanted to throw stress in there because I got to imagine right now is a time of high stress for most people. I mean, a lot of people are really concerned. Not to mention, I try to remind people like we're going through something right now, just living indoors, pretty much quarantined, that we've never had to go through before. And I don't think people take that as seriously, Dr. Dooley, as they should. You know what I'm saying? Like, you got a lot of stress on you if you're an average American right now. And,
absolutely.
And I don't think we are really considering that when we interact with one another, whether it's online or in person, how rarely that is, right? I don't know. Does that impact health as well?
Oh, 100%. Absolutely. I agree with you. We are living in stressful times. And that's what I tell my patients all the time. You have to be gentle with yourself. You can't be super hard on yourself. We are living through unprecedented times. We are living through a pandemic. You have to give yourself a break. Be gentle, be kind, be patient with yourself. Don't be hard on yourself. You got to let stuff go that you might not have let go before. Because at the end of the day, you're alive and you're healthy if you are alive and healthy. And even if you're not, you're alive. Because if you're in my office, you're alive, right?
That's right.
So there's such worse positions that you could be in this day and age, and especially with the lack of government support that we've been getting as a nation compared to some other nations who had, UBI, universal basic income, et cetera, et cetera. So we're getting a little support from our government and we're stressed. And it's important to remember to be kind and gentle with yourself and to be kind and gentle with others, because mental health and physical health is not separate. Just like vision health and dental health and mental health aren't separate from our physical health, even though this capitalistic healthcare system wants us to believe that it is, right? Yes. Not only do you have to have health insurance, you got to have dental and vision too. It's all the same. So stress does absolutely weaken your immune system and make you sick. And some of my highest stress women, and I say women specifically, Tim, because oftentimes we wear a lot more hats than men sometimes, because oftentimes, not saying that we should, but oftentimes we are doing a lot more when it comes to things at home. Not only are we working, we're picking up a lot more snack at home. We're more likely to be the children caring for our parents, not only caring for ourselves and our children and our loved ones, but caring for our parents if they're elderly and sick. And my most stressed women are my sickest women. And I see it coming. If they come in my office and they're stressed out, because most of what I do is mental health. I'm a family medicine general practitioner, but like I said, you can't separate those out. So most of what I do is mental health. And my highest stress women, I can identify within the next year, something bad's going to happen to them. And I'm not wishing that on them. Something bad physically. They're going to have a stroke. They're going to get COVID. They're going to fall and break their neck. I can see it because that mental stress translates to physical illness. It does.
Wow. Wow. I don't know what to say to that. I mean, it's a reality of life, right? A reality of the way society is kind of built, and that's one of the reasons why I wanted to do this. And I was talking to my wife, and I just said one day, I was like, I'm bringing all these guys on the show constantly because that's mainly who I associate with for a lot of reasons, as a guy in media on the left, I guess, I'm always cautious, right? Because I come from a corporate background. Always cautious. I don't want women to get the wrong idea. I never want there to be a misunderstanding. We do live in the Me Too movement. So that's part of it, to be totally honest, right? But I met Nina Turner many times. I mean, I feel like we're friends at this point. In person, interviewed her in person, followed her on the campaign trail. And she introduced me to some great people. And I said, you know what? To my wife, I said to my wife, I want to bring some Black women on. And let them, I want them to get more exposure. I want people to know about them. I want to know what's going on. I don't want to do the talking. I want them to do the talking. And that's just trying to dovetail with what you just said. And I learned a lot from Jennifer and, of course, Nina Turner. Now I'm learning from you, Dr. Dooley. If you don't mind, can we just pivot back to about COVID-19 vaccinations? And I think one of the things that make people hesitant to take the vaccine are not understanding the side effects, right? So they don't talk enough about side effects, and people get worried, and we have a lot of information out there about side effects. Dr. Dooley, what can people expect?
We're talking about side effects of the vaccine, and in all honesty, I was absolutely nervous about that too, especially with my second dose, because they say some of these side effects of the vaccine could be potentially worse after your second dose. So I went to my second dose. I was excitedly nervous about my second dose. I took the next day off of work because they said, the side effects might start the next day. So as a precaution, I took the next day off of work after my second shot. And because just like with, the internet, people who have a bad experience are more likely, leave negative reviews. It's just like that. The media is going to hype up everybody who has a negative side effect or whatever. But I'm a part of a women physicians Facebook group. We've talked about it. And the majority of people have had very mild symptoms after the vaccine, like me. Of course, there are some people who are going to be hit harder with some fever, some chills, body aches. With the Moderna, specifically more so than with the Pfizer, there's something called COVID arm, where they get a big red rash on the arm where they got the injection. So some people are going to get these side effects, but my experience was very mild. After the first shot, I had a little bit of tenderness in the arm. It wasn't a lot. I sleep on my left arm. I was still able to sleep on it. It was just if I kind of touched the area, it was kind of like a little tender. I was able to move it and everything. It's just I knew I had something done there. I had chills, and I was very meticulous about writing everything down. I had chills that lasted for almost exactly 4 hours because, again, I wrote down the time that it started, wrote down the time that it ended. So I had a little bit of chills for about 4 hours. And that's pretty much a little bit fatigued for about half a day afterwards. That's all I had after the first shot. After the second shot, I had a headache that started about 6 hours later. I took one over-the-counter pain pill. They don't want you to pre-medicate before the vaccine, but if you have a headache or fever or something after, you could take something. So I'm the type of person that if I have a headache, I usually take 2 or 3 over-the-counter pills to knock it out. So I just took one over-the-counter pain pill. It went away completely. I didn't even have arm pain the second shot.
Wow.
So out of the 4 people in my office who received the vaccine, 3 of us had relatively mild side effects like myself. One of us, after the second dose, had some fever, chills, felt a little achy, stayed in the bed a day. So 1 out of 4 of us had some of those side effects that you talked about. So I think those are pretty good odds. But let's look at that list. What are the symptoms of COVID? The symptoms of COVID are fevers, chills, cough, death, loss of smell, loss of taste, diarrhea. If you get long COVID, you might have some months and months of feeling fatigue. COVID is a clotting disorder. You can have a stroke after COVID. So if you look at the side effects of COVID compared to the side effects of the shot, I'm going to take my chances on the shot.
Well put. Well played, sister. Well played. When you were talking about it earlier, and you said, they say that Black folks are hesitant or resistant to taking a vaccine, but you said A lot of people are resistant to taking a vaccine.
I have a very diverse practice, and I'm seeing about an equal percentage of people of all colors who have some hesitancy. But in general, African Americans have a valid reasons to be distrusting of the medical community. And I've had some Black patients tell me, doctor, because I don't have the vaccines in my office now. They're, health departments and the hospital are giving them out. They're not giving them out to doctors, which I think is a flaw. But anyway, so I have a lot of patients of color who say, doc, I want the vaccine, but I'm only going to get it from you. You tell me when you have it at your office. And I'm trying to convince him to go get it somewhere else because I don't know when I'm going to have it. It might not be for a long, long time. But we need more Black doctors. Studies after studies show, this is not a racist statement Dr. Dooley's just throwing out there. Study after study has shown that Black patients have better health outcomes when their doctors look like them. I'm not saying that there's no white doctor in the world that can give a Black patient good care. I'm not saying that. I'm just laying down facts. Study after study shows that Black patients have better outcomes when they have a Black doctor. So we need more Black doctors. We need the percentage of Black doctors to represent the percentage of Black people in the population so that more Black people have a doctor that looks like them, that they trust so that they can get the information that they need and get some reassurance from somebody that they know and trust.
That segues perfectly into student debt that you talked about earlier, about the hundreds of thousands of dollars that you racked up. So I know this is a subject that you're very passionate about. I've heard you speak on it. Joe Biden talked about, I think it was 10% of it, $10,000, reducing student debt. Just from a doctor's standpoint, how much do you think would it impact those Black doctors if they got to go to school for free?
That would make a huge difference. Like I said, here I am. I don't know, after interest, I don't even look at it. It's so depressing. After interest and everything, I'm closer to carrying that $500,000 debt than $250,000 debt. So, and Black people in general, Black women, we're the most degreed women, right? Out there, we are the most degreed women. We also have the most in student loan debt. African Americans are more likely to get higher interest rates. And so not only will it help Black people, but we need more doctors in rural communities. And in rural communities, most of them are not wealthy. And so when you come from a rural community or you come from the inner city or, urban area and you go to medical school and right off the bat, you got hundreds of thousands of dollars worth of debt and you get a job offer in the city or in the rural area and it pays pennies compared to this fancy suburban position, which one are you going to take?
There it is.
Because you got all this debt to pay off. So not only will it help doctors, especially doctors of color, people who live in rural areas who want to be doctors, not only will it help us achieve our dreams of becoming doctors, but it's also going to help patients because if doctors don't have to choose where they work based off of who can help them pay off their loans the quickest, then we're freed up to work wherever we want to work. And usually that's going to be with people who look like ourselves.
Right. Man, Dr. Dooley, you're good at this. You should be a surrogate for a presidential campaign.
Tried that. Didn't work out the way I hoped. But I would be willing to try it again.
Well, I'm sure Senator Nina Turner could use some work because she's do some help because she's doing pretty well, man. I can see it, man. I love
Senator Turner. I would not be the person I feel like I'm a better person just having been blessed by being in her presence and just basking in her greatness has made me a better person.
Amazing. Another topic I know you're very passionate about, Medicare for all. Joe Biden said even if somehow through some miracle we were able to get it through the House and the Senate, which looks like it shouldn't take a miracle, right? Because now the Democrats own the House and the Senate. But he said even if we got it through there, he'd still veto it. Medicare for all, what would that mean to the patients that you've worked with over the years?
If we cannot get behind Medicare for all as a nation, I don't know what we can get behind as a nation. Everybody has to complain about healthcare costs from all walks of life, all colors. With every effort that we've had in this nation to ensure more people, right, whether it be the Affordable Care Act or expanded Medicaid, every single time there's still a disproportionate amount of poor people of all colors and Black and brown people who are still left uninsured. So even though Medicare for all is going to help everybody, because people of color are disproportionately uninsured, it's going to help us even more. And they know this, right? This is not a coincidence. This is not a hard problem to resolve. This is not some major conundrum. there's millions of people who don't have health care. How are we going to solve this problem? Tim, you could ask, a 10-year-old, hey, in America, some people don't have health insurance. What should we do about this? He's going to say, just give everybody health insurance. It is literally that easy.
Yeah.
And if we don't know how to do it, we can look to Canada. We can look to any other industrialized nation in the world to figure out how to help implement this. And so every year I get more and more patients saying, Dr. Dooley, I'm not going to be able to see you as much as I like to because my employer is switching to a high deductible plan, which basically means you don't have any health insurance,
Right.
which means you ration insulin, which means you don't go to the doctor when you need to because you don't have the copay or the deductible, and which ultimately means people die, just like people are dying because they're rationing insulin nowadays. So we know the data is very clear that Medicare for All will not only save lives, it will save money, it is going to cost us less. And we just have to stay on these politicians to do the right thing. And my fear, Tim, is if this pandemic didn't convince more politicians, I honestly don't know what will. I'm honestly scared to find out what worse than this past year, what worse would have to happen before we can get the people that we've elected that have health insurance before we can convince them that all of us deserve health insurance. So I'm scared of what it's going to take. But I'm not going to let my fear keep me from advocating for what is right and what we deserve.
You said something, doctor, that really resonated. You said, if you have an unaffordable or high deductible, do you really have health care?
No, you don't.
Damn. That hit hard. That hit a certain way because those numbers don't get counted,
Yeah,
you know what I'm saying?
You have insurance, so you don't get counted as one of the people being uninsured. So we have a pandemic of uninsurance, but even a bigger pandemic of underinsured. Almost everyone is underinsured. I have a couple, pro ball players, high fancy executives that, have some of the good plans. But why can't everybody have that good plan? Why can't everybody be able to go to whatever doctor they want to and not have to pull out their wallet and pay a penny? We can all have that. We can all have the best Cadillac plan. And it's actually going to save money. When people who are uninsured go to the ER and they get care because the ER can't turn them away if they don't have health insurance, who do you think pays for that? We pay for that. It's built into the cost of healthcare. Just like when somebody steals from the store, it's already built into the cost of the product that you're buying. We pay for that. So we are already paying for uninsured people by these high premiums, deductibles, and costs when we go to the doctor. And not only that money that we're paying is not all going to our healthcare. It's going to big pharma. It's going to private health insurance CEOs. It's going to tons and tons of hospital and health insurance administrators, because there's all this red tape that you kind of cut through to administer healthcare in the United States. Because if you have 100 different health insurances that you accept, they all have different rules for billing and reimbursement. So you got to hire people who are experts in each of those individual plans just to get your money, just to get your reimbursement. If we all have the same health insurance, we can trim all that fat and save so much money and save so many lives. It is an imperative thing to do.
Boom. Boom. I don't even know where else to go with this. I mean, I think you've expressed so much and revealed so much. I think it's going to resonate so much with my audience. Dr. Dooley, what are you working on now? And I don't know, how can people find out more about your services, your ideas? Are you writing a book? Are you going to get your own Netflix special? What's going to happen? What's up with Dr. Dooley?
To my own Netflix special. Okay, I'm open to that. You can follow me at Dr. Dooley, MD, DRDOOLEY, MD. I'm supporting my girl, Senator Nina Turner. We are working on the people for Nina to support her. So that's my priority right now is seeing her in Congress. And Cori Bush, yes. That's my girl I met as a surrogate with Bernie on the campaign trail. So we got her in there. I'm super excited about that. We're going to get Senator Nina Turner in there. And then, there's one more person from the Bernie crew, one more female that we got to get into Congress after we get Nina. I'm not going to say who it is yet, but you'll hear all on my timeline about it. So then we got to get them in there. So I'm just working on my girls, get my girls where they need to be. And then we'll figure out what's next for Dr. Dooley.
Well, we said, Dr. Dooley, we need to float you for Surgeon General. That's what we need to do. I know there's a lot of people watching wish they had a doctor like you to keep it straight and to look out for their best interests and make sure that they're healthy and that they're doing healthy things to keep it that way. Well, look, Dr. Dooley, I want to thank you once again for taking time out. I've been looking forward to this for a while. I'm glad to hook this up. Guys, follow her, Dr. Dooley. I put it in the description below how to contact her, how to follow on Insta or on Twitter.
Yes.
You got Instagram too?
I do, but I don't post much
You don't
on
post
Instagram.
nothing. Okay. Well, look, thank you once again and have a great remainder of your day, sister.
Thank you, Tim. Goodbye.
Goodbye. Perfect. Let me ask you something. Do they know us? When I say they, I mean the talking heads on cable news. Do they know you? I mean, they talk about the world as if it's a sport. They play political games, report on our pain, rack our brain to feed the stock exchange, but do they know us? Do they know what we care about? Nope. They're too far away. They can't see us. They can't feel us. They can't relate to us. See, when you want to know what's going on in your world, trust someone who lives in your world. Subscribe.